various points. So it has an impact, on the life of the woman, depending on the location. Where it occurs in the middle of the womb, where the endometrium is, it could cause symptoms related to menstrual disturbances, and when it occurs at when it's sited at other regions, it could actually impair fertility. Sometimes even the size could cause pressure symptoms. The uterine fibroids they're quite common, especially in blacks. In fact, some studies have shown that in the hysterectomy specimen, up to 80% of black women have uterine fibroids in various degrees. But by and large, it's about 50% of those moving around that will complain of symptoms related to uterine fibroids in their lifetime.
Okay. All right. Dr. Carlo, you continue from there. How common is uterine fibroid in our society? Let's not talk about outside Nigeria.
Yeah, just mentioned it. Yeah. Incidence of 70 to 80% in specimen that is used, that of women, the womb of women that was removed. Shows that a lot of women actually have this fibroid. There are about 50% will complain, but if that means if you are in a room and you have 10 women, you can be sure that at least 7 to 8 of them are likely to have fibroid. So it's a very common condition. More common in our environment than in Caucasians and other Asians. It's more common with Africans.
So what makes it so common? What are the major causes?
Okay. If I have to, by immediately find out the cause of uterine fibroid, I'm sure they will make me a promotion on it. Many of the institutions, yeah. A lot of circulations here and there, estrogen issues and all that, and familial issues, but nobody has ever come and said, okay, this is the cause of fibroid, and it's been accepted as a cause. But other of things have been suggested. But now the cause is actually unknown. Why these abnormal cells, muscle cells, will grow within the womb of a woman that has muscle cells, and these ones are growing differently. There's no real, because there's no known causative factor. But we know that it's commoner in those women that have either not given birth before, or they have given birth to only one person. It's more common as the woman's age advances, right? So that's why nature abhors a vacuum. So it's commoner in those category of people. It's commoner in blacks, as we have said, all right? Okay. And also more common when people are bigger.
Okay.
Right, so these are all some.
Okay. I know that some women are one of the reasons why, if you are not married, if you are not married, they will be advising you find a way and get pregnant so that fibroid will not come in.
In fact, that can also explain the reason why many more women are now having to come to have surgery for fibroid. They wait for so long before they start considering conception. So I think the incidence is more generally, because people are waiting before they marry for so long and they don't get pregnant. So that advice actually is appropriate.
Okay, so Dr. Nyeyoko, we are living in a society where once you appear, the first thing the people will assess you, particularly if you're a woman, and then if you are married, they will see a woman with big protruding tummy. The first thing they will ask, are you pregnant? They will say no. You now begin to suspect fibroid.
Okay, thank you very much. First and foremost, let me answer that question. Any woman with a big tummy, first in this pregnancy, you think.
Yes.
Next, it could be obesity, that is fat, and then also you can now think of other cancers, other tumors, ovarian cancer, and the rest, or other causes of ascites, before you now start thinking of uterine fibroid. But the first symptom that you've mentioned now is the fact that the patient will have an abdominal mass. Okay. Abdominal mass, something growing in the tummy, making the tummy look a bit bigger. Then also menstrual symptoms are actually very common, among women that have uterine fibroid. Menstrual symptoms could range from menorrhagia, which is the excessive bleeding. One can bleed excessively in terms of the quantity, the volume of the bleeding. She used to use one or two pads before, now she's doing like 6 a day, or even the duration. It could be lasting for more than a week. She's bleeding so much. You have intermenstrual bleeding in between menses. You have dysmenorrhea, that is pain during menstruation. Okay, so those are some of the symptoms, the menstrual symptoms that she could have. Then, based on location, like I said earlier, the womb does not just sit on its own in the pelvis. It's related to other organs. So we have what we call the pressure symptoms. So anterior to the womb, that in front of the womb is the bladder. If the fibroid is located in front and is irritating the bladder, she will have problems of urination, urinating frequently, or even obstruction to a point where the fibroid could impinge on the outlet of the bladder and prevent the woman from urinating. The same thing with the rectum, like the anus, the rectum behind, and on the sides it could affect blood vessels and ligaments and cause her to have swollen feet. Then also there's also pain associated with uterine fibroid. Uterine fibroid on its own, when it's small, it's not usually painless, but when it now starts impinging on nerves, and when it now starts growing to a bigger size, you now have dull achy pains, you have chronic pain in the pelvis, and then especially in pregnancy, there could be what we call regeneration of the fibroid, which could cause excruciating pain, especially in the first and second trimesters of the first 4 or 5 months of pregnancy. So those are the symptoms generally that are associated with uterine fibroid, and I think a lot of women would notice uterine fibroid for the first time when their menses start misbehaving, especially when they are having heavy menses, which can actually be so severe that it could lead to anemia, and the woman may need to even have blood transfusion if care is not taken.
Okay, you talked about the pregnancy, and so in that case, that means someone that has fibroid can still take it.
Yes. While I was talking, I didn't want to talk about infertility. I knew that Dr. Carlo was going to take that. Yes. Now, there's a causal and a causal relationship between fibroid and pregnancy. Causal meaning that a woman can have fibroid and get pregnant. Okay? It also means that a woman can have fibroid and it may not be the cause of her infertility. It's just there. But other things are causing the infertility. Then causal means that it is the cause of the infertility. So in some cases it is the cause because of the location. If it's one that is in a location where it's blocking the tubes or blocking the cervix, that could be. Then also in pregnancy, it can lead to miscarriages and other problems in pregnancy. Because if it's located in the endometrium, the baby implants on it, the baby may not have enough roots. It's the issue of the power of the sower. You see that fell on rocky ground. That is exactly that. That will not last long and will die away. So that is it. So I think that's the relationship between fibroid and fertility and pregnancy.
Okay, yes, Dr. Carlo. Let's still talk more about a little bit about it, pregnancy and fibroid. How do you manage it so that there won't be, maybe miscarriage?
Okay, thank you. One of the things we need to understand is that the symptoms that the woman comes with also depends on both the size and the site, the location of the mass. The fibroids can be within the lining of the womb itself, known as endometrium. So it's called submucous. It can be within the muzzle of the uterus, where it's called intramural. It can also be just outside the surface of the uterus, and that is called subserous. So most times the subserous ones, we don't bother too much with them, except they grow to very big sizes and they're causing pain and all that. But it's the intramural one that's within the muzzle, and particularly the submucous one that is worrisome. So we can do a surgery to just go and remove a 2 cm submucous fibroid. And so that's the truth. Because that's where baby is going to see. I mentioned that's where baby is going to implant. And you have issues with implantation, it can cause preterm delivery, it can cause severe pains, it can cause abortion and all that for the woman. So those are the ones who want to make sure that they are not there. So surgery is the mainstay. And surgery, actually the definitive treatment for fibroids is to remove the womb of the woman. But that's very radical. So we have a surgery known as myomectomy, which is a conservative treatment for uterine fibroid, where we go to remove those fibroids, particularly those ones that are constituting a nuisance to the woman. So that is a treatment for uterine fibroid.
Okay. Still talking about the treatment. Although there is a time we are going to talk more about that about the treatment, because I've heard several stories and myths concerning treatment of fibroid. But let's look at the drugs. Is there any drug for fibroid?
Well, basically, I would say no. Yes, there are drugs we can use, we as doctors use to shrink the fibroid, to allow us to do surgeries,
Okay.
right? To shrink the fibroid. For
Sorry, doctor, talking about when you talk about doing shrink the fibroid, allow you to do the surgery, doing surgery on the fibroid itself.
Yes, the thing is, there is a myth with all these traditional medical people. They deceive women and tell them that we can give you drugs that will just make the fibroid disappear. That is 419. It doesn't happen, right? What we do, there are times when the fibroid is so big that we don't want to go and operate on the woman with that kind of size.
Okay.
So we want to cause a reduction in size there before we go and do the surgery. It has certain advantages.
Okay.
Blood loss is less. They're able to help conserve uterus. So that's where the drugs can be used. But even the drugs, when you use them, some other people maybe are going, the one is bleeding so heavily and it's not ready for surgery. You can use those drugs to reduce the bleeding the man is having. But it does not just remove the fibroid and cause a cure. It doesn't happen. If you stop the drugs, the fibroids will go back. So definitely the treatment for fibroid is to do, or the conservative treatment for the woman that want to have present her fertility is mammectomy. And the fertility treatment is to remove the womb, which is hysterectomy. No drug shrinks fibroid for good and makes it disappear.
So no drugs can completely shrink fibroid. We've been hearing that kind of stories. Okay, Dr. Nyeyoko, Dr. Kalu said it's 419. If someone tells you that there is a drug to permanently shrink your fibroid without going for surgery. Now we've seen cases where one person can undergo surgery for fibroid for almost 3-4 times. You go the first time, if it's removed, the fibroid still come back. Why do we normally have that kind of cases?
The uterine fibroids have various genotypic variations. They are the ones that grow very slowly. In fact, while I was talking about the symptoms, I forgot to mention the very first symptom. It could be asymptomatic. She has it small, she doesn't even know. Maybe it's when she's pregnant, so say, okay, do scan, and they're seeing baby, they're seeing fibroid. And then I say, oh, you have a small fibroid, as small as a pea. So it's because of the genetic variants. There are some that grow rapidly. They do the mammectomy. I know during surgeries we can't see all of them. There are some that microscopic. Remember, it starts as a microscopic cell that now grows to become a fibroid. The microscopic one will not be able to see. Those are the ones that will grow, that now grow again. Okay. So it's not that the doctor left some.
Okay, and it's not that particular one that was removed and grew.
Not the one that was removed that grew back. It's a different one that was already in the process of about growing or started growing. That was
not seen. Okay.
Yes, and then it now grows and becomes a new one. So there are different variants of uterine fibroid, and that is actually where we have problem in counseling patients. Counsel a patient now, oh, we want to remove your fibroid. And that is the reason why we talk of nature abhorring bathroom. You do a moment for a patient and tell a patient, okay, after a few months, try and get pregnant. Especially if she's married, try and get pregnant. So that at least there's a baby in there, it doesn't give room for fibroids to grow anyhow.
Okay, so Dr. Carlo, I don't know if you have something to add there,
Yes, it's very important. I also know that it's not only open surgery that can be done for uterine fibroid.
Okay.
That is what they call minimal access surgery, which has gained so much prominence in the country, Nigeria now. And there are a lot of good minimal access surgeons that can actually remove your fibroid without you having to go to the knife, per se. So both hysteroscopy and laparoscopy is happening. Very good. We have a very strong association now in Nigeria, which we also belong to. That most of the practitioners are doing very well. Things comparable to what you don't have to go outside abroad to go and have these surgeries. You can come to us and to help you. Yeah, very, very safe. Safer than even the open surgery. So people are skilled.
And in terms of the costing?
Yeah, the costing, unfortunately, because of equipment too, it's a bit more expensive to have those minimal access surgery. Everywhere in the world, minimal access surgery is more expensive than conventional open surgery. But it's an option for women. Because most times women are afraid to come on time.
So afraid of the knife.
Yes, and we waste so much time. You know, at times it becomes too big, you cannot be able to access minimum access. You have to come on time and be helped.
All right, come on time and be helped. I think that is the take-home message from there before we go on the break. So you are still watching Fertility Half Hour, a program proudly supported by Life Point Fertility Center here in Uyo. Remember that you can contact them through either the visit or make a phone call. The number is there on the screen, and the address of the center is also there on the screen. We shall go for a break now. We will be back shortly. Welcome back. You are still on to Fertility Half Hour, and my name is Clement Barikui. And don't forget that this program is proudly supported by Life Point Fertility Center, Uyo. Always reach out to them via the telephone number on the screen. Okay, doctor, before we went on the break, we were talking about the treatment options. So let's still look at those treatments. You were talking about the other one that has to do with without the use of the knife, so to say. All right. So
I was just trying to explain that basically there are two modalities of treatment for uterine fibroid. There is the open surgery, where you use the knife to cut the woman open, and then go in there to inoculate and remove the fibroids, which has been what we are used to in Nigeria.
Yes.
But in the recent times, we have the closed surgery, minimal access surgery, where we can actually do what they call laparoscopy or hysteroscopy, and go in to be able to remove the fibroids. And the surgery, though more technical, but it also has less complications. The women don't have to stay too long. Most times within 48 hours, 24, 48 hours, you're home after such surgery. Yeah. Wow. At times you even go the same day. That's why when it's a hysteroscopic procedure, whereby you go into the womb through the vagina to remove the fibroids. Oh. So it's more technical, but has certain advantages.
Okay, so is it easily accessible here in Nigeria?
Yes, I just told you that the minimal access surgery is growing in leaps and bounds in Nigeria. And recently, over 40-something of us attended the World Congress on Hysteroscopy that held in Barcelona, Spain, led by one of our wonderful guys, Professor Judo Kowe. He organized for us to go for that congress. So, and we have the Aegis, a group called Aegis, as well of gynecologic endoscopy in Nigeria. So most people there are able to do minimal access surgery. But on a general level, the centers that do minimal access surgery are mainly concentrated in the big cities, especially the big three: Abuja, Lagos, and Port Harcourt. Okay. But we do hysteroscopy in my center, and a bit of the young man does his own. They're doing their own laparoscopy, but it's available.
Okay, Dr. Yoyoko. Earlier we talked about the use of herbs, to cure or completely shrink fibroid. And you said that, and Dr. Kalu said that, in fact, he described it as 419. So now I'm sure there are people that are, even while watching us now, might still have this doubt that if you take herbs, it will actually address. In fact, the people are still taking as we're talking. So let's just talk a little bit more on that. see how can you disabuse the minds of some people that are already into this?
Okay, yes. So it's important for us to note that yes, we agree that every medicine, every conventional drug started out as herbs. However, the chemicals were extracted and tested over time, and the concentration that is appropriate for a person, is measured and given, to prevent side effects. Now, these herbs that people are taking, a lot of them are actually not beneficial at all. The few that are beneficial may contain some hormonal consequence that would cause changes in the fibroid that makes fibroid treatment later on difficult to achieve. We call them degenerative changes. You see a fibroid that's supposed to be firm. They are supposed to, in surgery, are supposed to just put a little nick on it and it pops out and you plug it out, like the way we plug out corn. Good. But now, because of the herbs they've taken now, that fibroid now becomes very oily, now soft. The surrounding tissues, myometrium, now becomes abnormal. So by the time the person comes to the hospital and you are carrying out the surgery, you have difficulty in removing those fibroids. And even after you've removed the fibroid, you have to remove some of the adjoining abnormal tissues. And then such a person that is looking for fertility now has a very scarred uterus that now has difficulty in maintaining the pregnancy or even achieving conception. So I really want to advise our viewers that the use of herbs is not beneficial in any way to the treatment of uterine fibroid. It does not shrink the fibroid. It just makes it either a little softer or gives you the psychological benefit of feeling that you are doing something. I know the major fear people have is that they don't want to go under the knife. They don't want surgery at all. Yes, there's a new option that actually evades surgery. We call it high intensity focused ultrasound treatment, where you have the ultrasound waves are pulled to a point. So the waves now cause heat on that point. It's very technical, it's very expensive. The technology is only existing in very few countries, and I think Nigeria we have only one center. But West Africa only one center, which is in Lagos. I was fortunate enough to have some training in it for about 2 weeks, so I got to know much about the IFU system. It shrinks the fibroid and makes it, and the fibroid dies from within, and body excretes the byproducts with time. Okay, it can take like 6, 8, 9 months but usually for small fibroids. That is the caveat, and it's very expensive. So it still boils down to early diagnosis. Like Dr. Carlo had talked about laparoscopy and hysteroscopy, early diagnosis. Because very large fibroids are not amenable to laparoscopy and hysteroscopy. You still have to go under the main knife. So the time our people waste in taking the herbs makes them lose the advantage of this simpler. Yes, early diagnosis and the simpler treatments that they could have taken. Because as they take the herbs, the fibroid is still growing. Yeah. It's degenerating. The tissues around it are getting bad, are getting abnormal. And so at the end of the day, they will now still require the open surgery that still impacts negatively on their fertility potential.
Okay. All right, Dr. Carlo, before we go, let's look at fibroid and IVF. What are the possibilities that someone having fibroid can achieve 100% fibroid? If there is any, yeah.
Success with IVF. Truly, the uterus, the womb, is the resting place for the baby. So anything that will distort the womb will affect both natural conception and assisted conception. So people that have uterine fibroid tend to have a poorer outcome with their IVF. However, not only that when we see fibroids, we remove it every time in IVF. No. Most times when they do midterm, the lining of the womb is okay and it's intact. It's not affected. Except the fibroids in the other place are so big. We tend to go ahead to do our IVF. Knowing that out of every 10 women, about 8 of them already have fibroids and they're having their babies. So go ahead, and many women are giving birth through IVF. So many that have uterine fibroid. However, when it is not okay, we tend to consider removing the fibroid, repairing appropriately. Because when you're doing the surgery, anybody can do a surgery, but You need to also make sure that you're with the right people. The minimum is at least to be a gynecologist that is doing the surgery. To understand the issues about fertility and the issues about maintaining the integrity of that endometrium.
Okay. And so it has been on this edition of Fertility Half Hour. Thank you so much for always keeping a date with us. Remember to tune in again, same time, same station for another interesting topic. I've been speaking with Dr. Nsika Nyoyoko, a consultant obstetrician and gynecologist, and he's also a fertility consultant, and Dr. Okechukwu Kalu. Dr. Okechukwu Kalu is the medical director, Life Point Fertility Center. Yeah, you see you again, same time, same station. I remain Clement Barikui.